Hello.
Hello. Hi, Mike.
Hey. How you
Hey.
doing?
I'm good. How are you?
Not doing good. My
Not doing
heel
good.
hurts.
Your heel hurts.
Yes.
All right. Well, let's take a look at that heel. Tell me about it. Tell me all about it.
Well, here about a month ago, I noticed that when I wake up in the morning that my heel would hurt.
Mhm.
And I would go away throughout the day as I would get up and go to work. And then I'd take some Motrin or Aleve or whatever I had, Tylenol or BC powder, whatever I had. And but what I noticed is it's getting worse. When I get up in the morning, it hurts so bad. Whether or not I take pain medicines or not doesn't do anything for it. It's just time. If I'm up moving around in it, it goes away. Ish, mostly. It goes away. But when I first get up, it's terrible.
Yeah, it doesn't sound like fun
It
at
hurts
all.
right on my heel.
Yeah, ouch. And it makes it hard to walk probably at first.
Yeah, for a while. Yeah, until I get up and move around. I just limp around, then it feels better. I didn't hurt it. I didn't kick nothing. I didn't fall, nothing, twist it.
Okay.
Oh.
All right. Well, we'll see what we can figure out here. Okay. I'm gonna go back a little bit to your health history just as a recap. No problems. You don't really have a past medical history, major or anything. Just the wrist surgery that you have that one scar for.
Wrist surgery, yeah.
And your family's still healthy and
Yeah, way healthier than me. I'm in school. I work full time.
Okay.
I'm sedentary, and I'm getting fatter as the days go by.
Oh, well, you can't possibly be that sedentary if you're working and in school, right?
Yes.
Yeah, you can.
I'm not sedentary when I'm at work, and then I am sedentary at school.
So there you go. All right, and medications you're still on, lisinopril and baby aspirin?
Yes.
Okay, and you're allergic to nitroglycerin. We won't give you any of that. You don't smoke.
Mm-mm.
Still occasional alcohol use?
Yes, every chance I get, which is usually maybe every other weekend, maybe 1 week in a month.
Okay. You're still a registered nurse?
Yes.
Still married?
Yes.
Okay,
I
and
think.
you think if you see her?
Yeah.
Still have just the dog and 2 cats?
Mm-hmm.
Okay, sounds good.
Yes.
So nothing's changed since the last time we...
Nothing's changed other than my heel hurts.
It's just that your heel
Yeah.
hurts. And so what I'm hearing you say is that getting up out of bed, you have the pain and the burning, and it's been about a month that you've had it, and point to exactly where the pain in your heel is.
Well,
right there. Okay, right smack dab in the middle. All right. And so it's painful in the morning and better when you're up and walking. And what kind of pain is it? Like, would you describe it?
like somebody's stabbing me in my heel with a knife.
Okay, that's not fun. And so it feels better when you walk on it.
Mm-hmm.
What aggravates it? What makes it?
Getting up on it. I don't know, waking up in the morning and first standing up.
Okay.
That's at its worst.
All right.
Otherwise, it doesn't do nothing. Oh, you know, like when I got up here and I sat down and let my heel hang off, it's starting to hurt again.
Huh. Okay.
It's like that for some reason. I don't know.
It could be
And then when if I sit down for a while and I get up, it hurts for a little while and it goes away again.
Okay.
So that makes it worse.
Yes.
Stopping, sitting.
All right. Okay. And so, and it does it move? Has it gone up your ankle, up into your leg?
No, it's just right
no
there on my heel.
radiating, just in that one spot?
Right on the heel, yeah.
Okay. And any other issues? You haven't been sick lately, and you said you haven't fallen or done any sports or injury or anything like that, right?
No.
Not to
I
fight,
couldn't do any
didn't
sports.
kick anybody?
No.
Okay.
No, nothing like that.
All right. Well, what I'm going to do is I'm just going to kind of take a peek at everything I can. I'm going to kind of check your foot out, of course, and where that heel pain is, but also, you know, just your leg and your ankle, too. So I'm going to have you stand up for a minute. Just all the way flat. Why don't you come down here, because I don't want you to fall off of that thing. That wouldn't be fun.
Okay.
All right. And so I'm looking at his feet, both, well, obviously he's got one shoe on and one shoe off, but, you know, his posture looks fine. He's, you know, symmetrical. I don't see any issues as far as, you know, musculoskeletal-wise unless you do that. Anyways, I'm going to have you, try to go up on your tippy toes. And how does that feel?
The same.
The same?
It doesn't hurt. No.
It doesn't feel better?
No, once I stood up, it doesn't, the pain kind of goes away.
Okay. So that makes it feel a little bit better.
Uh-huh.
Which is basically stretching that, whatever, you know, your fascia.
Uh-huh.
All right, go ahead and sit down.
Okay.
Next, I'm going to look at the skin around your leg and everything. You don't have any bruises or contusions or ulcerations. Your skin is warm and dry, not red or hot or any indication of any wounds or anything like that. And so I'm basically kind of like going to go from the knee down and kind of feel, does any of this hurt?
Mm-mm.
No pain at all
Mm-mm.
for the touch. And then I'm going to do his pulse here. Pedal pulse is very strong, no problems there. And no pain is when I'm touching any part of your foot or toes on top.
Nothing on top.
Okay, so next I'm going to have you put your toes up to the sky. Okay, point your toes. Okay, and does that hurt with either one of those movements?
Maybe it hurts a little bit when I point my toe.
When you point your toe? Okay.
Uh-huh.
And so looking for any masses, soft tissue masses, or any bony prominences that come out, and I don't feel anything that would indicate any tumors or anything like that that would be pressing on a nerve. And then I'm going to palpate your heel on the outside, and is there any pain or sensitivity with that?
Maybe on the outside, a little bit there. Yeah.
And then right.
Yeah,
there,
yeah, definitely.
that
Yeah.
There. Okay. And then I'm also going to look at this side over here where your calcaneal area is over here. And I'm palpating to see if there's any pain or tenderness over here.
No.
And there isn't any, right? Okay. I am also going to when I had him raise on his toes too, that also tested his gastrocnemius tendon as well for any kind of sensitivity or inflammation that can also cause pain sometimes down to the heel. And so your medial calcaneal area is not tender and everything. And we did dorsiflexion and plantar flexion to see if there was what kind of pain and everything he had with that. And the tarsal tunnel, the 10L sign, I'm going to hold his foot because it's too hard to have him move and all that kind of stuff. And then you're going to have your leg just kind of be like just relax it basically.
Mm-hmm.
And then I'm going to tap over here. Okay.
Medial side, yeah.
Yep. I'm going to go over here on this side first just to see.
Yeah, nothing there? Yeah.
Okay.
Nothing
All right. So nothing hurts there.
Uh-huh.
All right. And but basically, how about any pain here?
Nope, no pain there.
And I go down further.
Nope, no pain.
Right there.
Yeah. And actually, there used to be pain there, but it's not hurting there no more, really.
Okay. So basically, what I'm thinking is plantar fasciitis that would require you to continue on with some of your treatments. I know you said some of it's not helping, but I want you to try and take medication more regularly. But basically, also stretching that out. You can go to the drugstore, and they also have things that will keep your foot flexed when you're sleeping.
Okay.
Because sometimes, like if you're like this, you see like how you said it starts to hurt more when you're, okay, so you're just kind of like, eh. Yeah. And so basically it stays in that position and you want to stretch it out. So doing foot stretches, I know you said orthotics didn't hurt, maybe a different, maybe a different kind of try. I can also refer to the podiatrist for orthotics that they recommend that will be better. You can also take a tennis ball and roll your foot on a tennis ball. There's other exercises and things, and I'll give you a handout for that. But I'm pretty positive that that's what's going on. I'm glad that it's nothing else serious with your ankle. There's no ankle instability. There's no peripheral nerve damage or anything that I would think would make me think there's any other issues. Stress fracture. I forgot about that one. That would be the other thing. You're supposed to get this thing to, and then, does it hurt? No? Does it hurt? No? And then I should have tested for a stress fracture as well while I was examining him. So my differential diagnosis would have been a calcaneal, I can't say that word, nerve entrapment or cyst, and I didn't see or palpate anything. And the test that I did for that didn't show any nerve issues, no ankle instability, no stress fracture, and also gout would have been a systemic disease. But he doesn't have red, hot, swollen, shiny, and his pain isn't rapid onset. It's been kind of gradual and consistent. I tested his vascular system with the pulses, dermatologic system with the varicosities, looking for varicosities, ulcers, soft tissue masses, his neurologic system with the tarsal tunnel Tinel sign, and the muscular system with his tendons, his flexion, dorsiflexion, and pain in his ankle. And that concludes my video for today. Thank you.